Hi, everyone. Thanks for having me today. It's really great to be able to speak with you all about caregiving. Let's make sure I know how to do this. Yep, easy. Just press the green button. Okay, so caregiving is quite common in the United States. 1 in 4 Americans is a family caregiver, and that's increasing. And we're expecting as people age, it's going to increase astronomically. Caregivers spend an average of 27 hours per week providing care, and 24% provide 40 or more hours a week, so it's labor intensive. 1/2 of working caregivers experience impact on their employment, so there's financial ramifications of being a caregiver, and nearly 1/2 report at least one negative financial impact for their caregiving responsibilities. It also takes a toll on physical and emotional health. 1 in 5 caregivers will rate their health as fair or poor. And you can see here I have 2 graphs demonstrating that women are more commonly caregivers than men. And the average age of a caregiver, at 33%, you could see age 50 to 64. So right at the peak of caregiving, we're also graduating our kids from college, and we could be doing many things for many different people in our lives at the same time. So the caregiver role, what sort of things are caregivers doing? It, of course, depends on what the person has that you're caregiving for. People will need different amounts of care. Medication management is a big one, especially as people get older or there's a lot of different medications that have to be taken and organized. Dietary monitoring, appointment coordination and going to appointments and carrying out recommendations, as well as symptom tracking. And then emotional support, being available for the person with the chronic illness when they're having mood changes, when they're feeling low, feeling down, provide them encouragement, advocating for them for their care at doctor's appointments or other appointments, being able to make sure they get the things that they need. And at the same time, supporting their independence, because everyone wants to be as independent as possible and maintain their autonomy. So much, like I said, depends on the trajectory of the disease and the care needs of the individual. Does the illness require lifelong care? Or is it someone need caregiving periodically, like if they have an exacerbation of illness or surgery? What physical symptoms are impacted? Is it neurologic, psychiatric, hepatic? I would argue that psychiatric and neurologic can be some of the hardest symptoms, signs and symptoms to care for. Will the illness progress in a predictable fashion, or are you going to get unpredictable exacerbations or new signs and symptoms that will come up on you as a caregiver that you may or may not be ready for? I think this can really increase stress. And what are the caregiver roles and how will they change over time? What you're doing now might not be what you're doing a year from now. Someone might need increased support or want you to back off, and can you respond to those changes? And can we help the person with the illness maintain their autonomy? Again, very important and really something that comes up often. So the key point here is understanding the condition helps caregivers anticipate and reduce anxiety about the unknown. What's the disease course and how can we plan accordingly? I do see those who aren't planning or aren't ready for the next thing often have the most trouble as caregivers. So let's talk about caregiver burden and burnout. And again, this can be very much individual, based on the individual and their coping ability. And it also can depend on the disease of the person you're caring for, how many exacerbations they have, what new symptoms are coming up and new challenges. So what does care burden and burnout look like? And I'm going to show you a few different ways to think about this, but physically, caregivers who are getting into trouble are going to get fatigued. They have trouble with sleep. Frequently, their own illness can be worsening, or they're having exacerbations or not taking care of themselves. There can be increased anxiety and depression and irritability of the caregiver, not being able to tolerate what perhaps they might have been able to tolerate previously. Caregivers can get very isolated and socially withdrawn, and they can really move around away from those people that are helping care for the caregiver as well, and this can be a sign that they're getting burned out. And there can be difficulty concentrating, forgetfulness of the caregiver, and other psychological issues. So caregiving is both an honor and a burden, and many caregivers that I meet will not talk much about the burden unless I really dig in to try to find out, because they really feel like it's a privilege often, and they don't want to seem weak or that they're not able to do what they have promised they will do to the person they care for. So I really love this graphic. It's thriving, surviving, struggling, and crisis. And it actually comes from the stress from first aids of firefighters and emergency services personnel, but it really applies to caregiving as well. And so people can be thriving. A caregiver can be thriving. They've got this. They are calm. They're steady. They can just roll with the punches. They can handle whatever comes their way. They're able to take feedback, which can sometimes be painful. And they're able to continue to communicate effectively with those around with them and their care partner. And then they're surviving. So something's not quite right. They're starting to have a little bit of trouble, maybe a little more anxiety, nervousness, more easily overwhelmed. Things that didn't really overwhelm them suddenly is becoming problematic. They feel like they have to bite their tongue, really try to control their emotions. There might be some trouble sleeping or eating, and relationships seem to be more tense. This can move on to struggling. I can't keep this up. The pace here of the caregiving is getting overwhelming. I don't know how long I can do this. And here you'll see more psychiatric symptoms for the caregiver. They're not performing as well. They're having more difficulty. They're not as available. They'll avoid interaction with those around them. And they get restless, disturbed sleep. They're really starting to show signs that they're having trouble. And really the caregiver needs to check in with themselves and say, okay, am I getting overwhelmed? Is this becoming a burden? What am I going to do about it? How am I going to get myself back to the surviving or the thriving stage before they end up in crisis when they completely can't cope anymore? I can't survive this. They're very distressed. They can't act as all the different types of caregiver activities they're supposed to. And we really want to avoid people getting into this crisis, because the caregiver for someone with chronic illness is so instrumental for that patient, that care partner thriving. So here's a little case for you. This is Mrs. L. She cares for her son, but never asks for help. I don't know if you know anyone like this. I will not ask for help. You can press her, though. You can say, like, let's talk about this. Why won't you ask for help? Really try to dig in. And the thing she'll say is, I'm the only one who can take care of my son properly. I'm it. I am the only one. I know what my son needs, and I am the only one who can deliver it. And if I'm not there, something bad's going to happen. Some harm's going to come to my son. And if I leave my son for any length of time and leave him in someone else's care, something bad will happen to him. And this is going to really undermine her caregiving role over time, because it's about letting go a little bit and Mrs. L taking some time for herself, because other people can step in. And they can be taught how to provide care, and they can fill in those roles if Mrs. L will just let go a little bit and teach another person what needs to be done. And in the same breath, caregiving is such an honor for Mrs. L and gives her a sense of purpose. She is a caregiver to her son, and that's her identity, and that's who she is. And it's important and valued by Mrs. L. And so you can see here a graph from the same survey that recently came out. How many caregivers really feel a strong sense of purpose? 51%. And that sense of purpose is really something that many caregivers will discuss with me when we talk. So here's more from the National Alliance of Caregiving, the report that just came out. You can get it online for free. 19% of caregivers report high physical strain, 38% high emotional strain, and 24% report feeling alone. And this is for all caregivers, not just for any particular condition. And then you can see here caregivers self-rating their health, and a little over 20% will rate their own health as fair or poor. And that's when that caregiver relationship is going to really get strained, is when the caregiver needs to care for themselves. And I'll tell you that often caregivers will neglect their own health, and the only time they end up getting health care is when they end up calling an ambulance and going to the emergency room, because they do not want to leave or be taken out of that role. And so it's really important for chronic care, chronic medical attention, for the caregiver to be pursuing that for themselves. So self-care strategies: recognize and prioritize yourself as a caregiver. Set boundaries. It's okay to say no to things and ask for help. Maintain routines. Recognize when you're getting out of your routine, that your sleep's not doing well. Make sure you're getting healthy meals, that you're exercising. You are valuable to this care partner, and you need to stay healthy. Stay connected. Don't isolate from friends or family. Pursue interests. Try to maintain hobbies that are unrelated to your caregiving role. Do things that give you joy and that are just for you. Practice mindfulness, meditation, deep breathing. Even 10 minutes of deep breathing meditation can really help reset that stress and anxiety that can come with caregiving. And then seek respite. So getting a few days away and someone coming in to fill the caregiving role, even if it's 2 hours, twice a week. Get someone else to come in and to maybe take the care partner to an appointment or whatever it is. But regular breaks can be really important, and respite can be very valuable and help reset that emotional strain. Here's some other practical stress management: prioritizing tasks, delegate when possible, use calendars, medication trackers, checklists, things that can help you, especially when you feel overwhelmed. Financial planning, explore assistance, especially when your job is being affected. Problem solving, break challenges into manageable, smaller steps. Flexibility, accept that some days will be harder than others and prepare for those. Managing a chronic condition and being a caregiver is a marathon, not a sprint, so it's going to be with you for a long time. Just a couple more slides. I just want to mention building a support network, either professional support or personal support. Who are those people around you who will be reliable and non-judgmental and be able to fill in when you need them to, or just give you some extra support? So looking for that and making sure that that's available to you and planned. And then effectively communicate with your care partner, the person you care for. Let them know how you're feeling and how you're doing, and be able to express your feelings and what's going on, so you can both work together to validate each other and validate emotions. Collaborate on care decisions and respect independence of the care partner when you can. And then you can see here some other communication suggestions with the healthcare team: preparing questions before appointments, so you're ready when you go in and you're not in that state where you go home and you're like, oh, what should I have asked? Or I should have asked this and I forgot. Keep organized health records, report changes in symptoms and behavior, and ask about available resources for caregivers. This is just a depiction of one of the things on the NIH website from the National Institute on Aging. There's tons of information on the National Institute of Aging website about caregiving, which really is for anybody doing caregiving, not just caring for older adults. And then here, the last, I think, slide is when to seek help, or almost the last slide. Don't wait if you experience sadness, persisting feelings of hopelessness, anxiety, you're not functioning well. Check in with yourself. What's going on? Do I need help? Do I need a break? And then substance use. If you see yourself drinking more alcohol or self-medicating a little bit more, that might be a sign of a problem. And then complete loss of your interest in your other activities. So seek help when you experience these things. They can really be flags for you that you need to care for yourself a bit. So here in summary, your well-being directly impacts your ability to care for somebody else. Self-care is not selfish, it's necessary, and you don't have to do it alone. Ask for help. Small steps towards wellness can make a big difference. The 10-minute check-in and meditation or other yoga or other things that help you relax. You're important and you're doing valuable work for the care partner. Taking care of yourself doesn't mean me first, it means me too. And here's some additional caregiver resources that I've listed here that you can look up on the internet. So I'd like to thank you very much for listening. I appreciate it.